Herpes simplex virus. Herpes simplex virus, human herpes viruses types 1 and 2, commonly cause recurrent infection affecting the skin, mouth, lips, eyes, and genitals. Common severe infections include encephalitis, meningitis, neonatal herpes, and, in immunocompromised patients, disseminated infection. Mucocutaneous infections cause clusters of small painful vesicles on an erythematous base. Diagnosis is clinical, laboratory confirmation by culture, polymerase chain reaction, direct immunofluorescence, or serologic testing can be done. Treatment is symptomatic, antiviral therapy with acyclovir, valacyclovir, or famciclovir is helpful for severe infections and, if begun early, for recurrent or primary infections. 8 types of herpes viruses infect humans, 2 of which are herpes simplex viruses, HSV. Both types of herpes simplex virus, HSV1 and HSV2, can cause oral or genital infection. Most often, HSV1 causes gingivostomatitis, herpes labialis, and herpes keratitis. HSV2 usually causes genital lesions. Transmission of HSV results from close contact with a person who is actively shedding virus. Viral shedding occurs from lesions but can occur even when lesions are not apparent. After the initial infection, HSV remains dormant in nerve ganglia, from which it can periodically emerge, causing symptoms. Recurrent herpetic eruptions are precipitated by overexposure to sunlight, febrile illnesses, physical or emotional stress, immunosuppression, unknown stimuli. Generally, recurrent eruptions are less severe and occur less frequently over time. Diseases caused by herpes simplex virus. Diseases include mucocutaneous infection, most common, including genital herpes, ocular infection, including herpes keratitis, central nervous system, CNS, infection, neonatal herpes. HSV rarely causes fulminant hepatitis in the absence of cutaneous lesions. In patients with HIV infection, herpetic infections can be particularly severe. Progressive and persistent esophagitis, colitis, perianal ulcers, pneumonia, encephalitis, and meningitis may occur. HSV outbreaks may be followed by erythema multiforme, possibly caused by an immune reaction to the virus. Eczema herpeticum is a complication of HSV infection in which severe herpetic disease develops in skin regions with eczema. Mucocutaneous herpes simplex infection. Lesions may appear anywhere on the skin or mucosa but are most frequent in the following locations: mouth or lips, perioral infection, genitals, conjunctiva and cornea. Generally, after a prodromal period, typically 6 hours in recurrent HSV1, of tingling discomfort or itching, clusters of small, tense vesicles appear on an erythematous base. Clusters vary in size from 0.5 to 1.5 centimeters but may coalesce. Lesions on the nose, ears, eyes, fingers, or genitals may be particularly painful. Vesicles typically persist for a few days, then rupture and dry, forming a thin, yellowish crust. Healing generally occurs within 10 to 19 days after onset in primary infection or within 5 to 10 days in recurrent infection. Lesions usually heal completely, but recurrent lesions at the same site may cause atrophy and scarring. Skin lesions can develop secondary bacterial infection. In patients with depressed cell-mediated immunity due to HIV infection or other conditions, prolonged or progressive lesions may persist for weeks or longer. Localized infections can disseminate, particularly and often dramatically in immunocompromised patients. Acute herpetic gingivostomatitis usually results from primary infection with HSV-1, typically in children. Herpetic pharyngitis can occur in adults as well as children. Occasionally, through oral genital contact, the cause is HSV-2. Intraoral and gingival vesicles rupture, usually within several hours to 1 or 2 days, to form ulcers. Fever and pain often occur. Difficulty eating and drinking may lead to dehydration. After resolution, the virus resides dormant in the semilunar ganglion. Herpes labialis is usually a recurrence of HSV. It develops as ulcers, cold sores, on the vermilion border of the lip or, much less commonly, as ulcerations of the mucosa of the hard palate. Genital herpes is the most common ulcerative, sexually transmitted disease in developed countries. Genital HSV can be caused by HSV-1 or HSV-2. Herpes simplex keratitis. Herpes simplex keratitis, HSV infection of the corneal epithelium, causes pain, tearing, photophobia, and corneal ulcers that often have a branching pattern. Herpetic whitlow. Herpetic whitlow, a swollen, painful, erythematous lesion of the finger, results from inoculation of HSV through the skin and is most common among healthcare practitioners. Neonatal herpes simplex. Neonatal HSV infection develops in neonates, including those whose mothers have no suggestion of current or past herpes infection. It is most commonly transmitted during birth through contact with vaginal secretions containing HSV and usually involves HSV-2. Neonatal HSV infection usually develops between the first and fourth week of life, often causing mucocutaneous vesicles or central nervous system involvement. It causes major morbidity and mortality. Herpes simplex virus on lips. Herpes simplex virus lecture. Herpes simplex virus 1 IgG positive means. Herpes simplex virus in Hindi. Herpes simplex virus Bangla. Herpes simplex virus animation. Herpes simplex virus in pregnancy. Herpes simplex virus replication. Herpes simplex virus dermatology. Herpes simplex virus encephalitis. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.